let's go ahead and get started, you guys. It's 1 o'clock on somebody's phone somewhere. Let's go ahead and get started. Can I get a roll call, please?
Yes, Chair. Chair Delgado,
Here.
Vice Chair Lucy,
Here.
Michael Brown,
Here.
Councilman Dare will be absent, I believe, Chair. Dr. Danko,
Here.
Dr. Novak,
Here.
Tom Young.
Here.
We have a quorum, Chair.
Perfect. Vice Chair Lucy, please lead us in the pledge.
I'd be honored, sir. Thank you. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, sir. Appreciate that. Miss you not sitting next to us.
Yeah, unfortunately, a little back problems this morning, and I can't go too far from my ice pack.
All that quad running, all that quad driving out in Montana, right?
That's exactly right.
All right.
That's
Glad you're safe.
Thank you,
Do we
sir.
have any general public comment?
We do not have public comment registered, Chair.
We'll close item 3, public comments. Moving on to item number 4, approval of the agenda. Mr. Kevin Dick, do we have any changes to the agenda?
Yes, thank you, Chair Delgado. There's a request to table item 9, the influenza presentation, until the April meeting by Councilman Dare, so he can be present since he had requested that item. And then we'd also like to move up the item 11, discussion and possible direction regarding legislative issues, to right after consent, so that Ms. Gutman-Dodson can be available for a hearing coming up at 2:30.
Perfect. Can I get a motion to approve the agenda as noted by Kevin Dick?
Motion to approve as amended.
Motion and a second. All those in favor say aye.
Aye. Aye.
All opposed? Motion carries unanimously. Thank you very much. Moving on to item number 5. Mr. Kevin Dick, please, recognitions.
All right. Thank you, Chair Delgado. I'd like to begin with years of service and begin with Sunita Manga Soni, who's our WIC program registered dietitian nutritionist, and we are recognizing and thanking and congratulating her for 25 years of service. She was originally hired in March 1996. And also recognizing Mark Dugan, environmental health specialist, EHS, with 15 years of service to the health district. So thank you, Mark, and congratulations. Nicholas Flory. Nick is an environmental health specialist with EHS, also with 15 years of experience. Christopher Peterson. Chris is a licensed engineer with EHS and has hit the 5-year mark with the health district. And Michael Crawford, an air quality specialist, also 5 years with the health district. So our thanks to them for their years of service here. We also have a new hire, Petra Bartella, who we've brought on as a COVID-19 grants coordinator. And she joins us. She was a grants coordinator at the Sheriff's Office previously, started with us on the 15th of this month. I'd like to recognize Daniel Timmons for his promotion from air quality specialist to senior air quality specialist. That's for the monitoring program in air quality, and he was promoted March 1st of this month. Then we have a retirement. Mark Dugan, who I'd mentioned previously, is retired as an environmental health specialist and on the 12th of March. And so I had the privilege of attending a cupcake socially distanced event where we presented him with a clock and a certificate for his retirement. So that was quite nice. And then we have, for the first time, some Green Biz recognitions that we would like to recognize the recipients of that award, and I'd like to turn it over to Mr. Wes Rubio at EHS to make those recognitions.
Hi, this is Wes Rubio for the record, supervisor with EHS and chair, members of the board. It's my honor to give a quick little talk about the Nevada Green Biz program, and special thanks to Mr. Mark Cameron, who's the new executive director of KTMB, and Kim Rios for their assistance in getting all of this together and helping us out and getting the word out. So the Nevada Green Business Program offers a framework that simplifies efforts to implement sustainable practices. Once a business registers with that program, they can document their actions taken with an easy-to-use platform called the Green Biz Tracker. Certification is voluntary, and that's really important to know that out of all of the 3 classifications, businesses do this of their own will. Tier 1 is the most basic level and action required for certification. It's a business accomplishes the tasks that make it easy to recycle. They offer employees alternatives to drive alone, commutes, turning off equipment when not in use, and other things. Tier 2 is a little bit more business sector specific and focuses on technical changes, such as purchasing the green energy option for your community choice energy provider or utility, completing a carbon footprint calculator, and determining greenhouse gas emissions, and others. Tier 3, which is called the innovator status, it's the highest level. It allows for businesses to promote social equity and sustainability, significantly reduce their carbon footprint, and even become a green business mentor. The 3 businesses that we're going to be honoring today, they have all voluntarily gone through the Tier 3 innovator status. The first is Davidson's Organics. It's a food manufacturer headquartered in Sparks. Co-owner Kunal Patel believes that Davidson Organics can always do better as it strives towards its goal of completely eco-friendly sourcing and manufacturing. This led Davidson's to become Nevada's first manufacturer to reach the innovator certification status. It's a big item for Davidson's Inc. and was improvement of energy efficiency at a new 50,000 square foot facility. Motion sensor LED lighting was installed. Walls are painted with high gloss white to reflect light throughout the building. New skylights were installed. Floors were coated with natural eco-friendly epoxy. Every air gap from floor to ceiling was sealed. Cellulose insulation was installed, and heating units were relocated to provide optimal performance. Davidson also minimizes their packaging and plastics and uses non-toxic cleaning supplies in their manufacturing operations. Tea waste from the manufacturing operation is also composted. And these are just a few of the notable examples of why Davidson Organics achieved their certification status as an innovator in Nevada. Nevada Roots is another business. They're a home-based landscaping service in Reno. Mark and Janelle Stathis have founded the Nevada Roots on the basis of sustainability and environmentally conscious practices. Nevada Roots has achieved the innovator tier level of certification for some of their notable practices. For example, at home, they already begun transitioning their landscaping from turf to a more natural shrub and urban forest design to help reduce water usage from irrigation. The lawn area was reduced by more than 75% from 2,000 square feet to 400 square feet. Site visits, routing, and scheduled to minimize fuel efficiency or fuel use and maximize efficiency. Nevada Roots composts 90% of its waste by transporting the green waste to RT Donovan, which is a local composting facility located just out of Sparks. A box chipper is on order to reduce the volume of waste, and Mark estimates he will take 85% fewer trips to the composting facility, eliminating nearly 100 trips that will save nearly 4,000 miles of driving and fuel use. These are just a few notable examples of how Nevada Roots has achieved their innovator status. The third business is Merchology. It's a custom apparel and gifts manufacturing company with a branch in Sparks, Nevada. This is 1% for the Planet member produce. This 1% for the Planet member produces custom apparel. Sorry, that was a really hard sentence for me. And gifts with quality and sustainability at the forefront of their operations. With support from the executive team, Brian Tart, operations manager, achieved the highest level certification for Merchology in Sparks branch. Merchology incentivizes employees into doing some green habits every day, like riding a bike to work, offering telecommuting opportunities, and a flexible schedule so workers can avoid heavy traffic commutes. Merchology has a robust reuse and recycle program that allows them to divert 90% of their waste from the landfill. They reuse reconditioned packaging materials in their own shipments, and they purchase or obtain previously used furniture, supplies, or materials. Merchology also ensures that at least 50% of your suppliers are local, within 50 miles, and or locally owned businesses. These are just a few of their examples of how they became innovators within the Green Biz program. And I'd like to thank all three of them for joining in on the meeting today and for achieving such a wonderful certification and going through this. Again, it's voluntary. So this really means a lot to our own waste management program here and with KTMB support. Thank you.
Well, thank you, Mr. Rubio, for that presentation, and thank you to all those for your years of service, the new hires and the promotion, and of course the retirements. Thank you all for your constant give back to the community, the public service. We are number one for no other reason but for your guys' commitment. And thank you to the new Green Biz recognitions. That's amazing. Talk about raising the bar, right? Talk about raising the bar. The amount of effort that it takes to get a business to that point is amazing. So thank you, Davidson's Organic, Nevada Roots, and Mercology. I appreciate you guys so much. And I know some of you are on Zoom as participants but don't want to speak, but please, on behalf of myself and the rest of the board, thank you. Does anyone that would like to say any comments on the board? Seeing none, we'll close item 5, recognitions. Moving on to item 6, any public comment with relation to consent items?
No public comment registered, Chair.
No public comment. Does the board want to pull any of the consent items?
Hello, Chair. This is Christopher Dare. I just want to, sorry I'm late, but I am here and I can move to approve.
Thank you for joining us, council member. I got a motion. Can I get a second?
Second, Rika, Danko.
I have a motion and a second. All those in favor say aye.
Aye.
All opposed? Motion carries unanimously. Thank you very much. Moving on to item number 7. We are gonna move item 11 up to have a discussion of possible direction from Ms. Gutman Dodson.
Good afternoon, everyone. How are you today?
Well, good to hear your voice.
Good to see everybody. I'll try to make this quick. I do think there may be a little bit of discussion when I'm done regarding a couple of questions I have in terms of guidance. So just to start, I want you all to know that right now we're tracking about 265 bills out of approximately 700 that have been dropped as of today. There has been some fast and furious work, I'd say, in the past week or so of new bills dropping. So there's been a flurry of activity this week. There also was some change in deadlines. So individual introductions of bills by legislators got pushed back, as did committee bills. They also got pushed back. So what I think is going to happen is basically deadlines are kind of out the window. There was a deadline this week in terms of getting bills out of first house or coming up soon. I can't remember what day that was. Mike Brown might know, but I think that's going to get pushed back too. So sometimes deadlines were a really great place to discover that this bill is gone and we don't have to worry about it. That's not going to happen this session. Every bill is alive and well until they tell us no. So that makes things a little bit hairier. Just this week, we've probably been involved in over 20 bills. They're getting dropped and scheduled and heard all within a week or two, all within a couple of days. So there's no actual, nothing's been passed, but these are bills I'd just like you to be aware of that are happening today or tomorrow or have happened this week. SB 209 was sponsored by Senator Donate, and it gives allowances to all employees that work for someone with over 50 employees for up to 4 hours to get a vaccine with paid time off. But the piece that really impacts the health district, and he actually asked for our input, was to create a study through the interim health committee during the interim to look at the state and local response to COVID and where we went, what we did well, and where we could improve, as well as possibly having some BDRs next session sponsored by the Health Committee that reflect what the state needs to do in order to respond to pandemics more efficiently. So that's a good one. I'm going to cross that out. AB 349 is a classic vehicle loophole bill that we've been waiting for. That language got dropped this week. So that's a good one that we're excited about. And I've also been in touch with several green solar companies and other sort of green efficiency companies that are really eager to hear it. So that's good news. It also could potentially give us some more revenue. The fees that are collected from it would go into the air pollution account. So it's hard to determine if it would be more or less. I think it would be more. That's what Francisco and Dan have told me. There's a lot of bills that seem to not have been written the way the bill sponsor has been intended. So there's been a lot of conversations back and forth with legislators about this was the original intent. That's not how it was published. Here, we're open to amendments, but then sometimes we're at hearings and we're not getting the amendment till the work session. And then it's a conceptual amendment. It's not an exact amendment. So it's a little scary, but it's just required more conversations with legislators, which is not a bad thing. So there's a few of those. One is AB 260, and it's trying to protect people's confidentiality during contact tracing and prohibiting law enforcement from basically showing up at your door and saying, you know, you haven't followed your quarantine. So then I understand the intent, but it limits the amount of time we can hold data, which very seriously impacts our funding sources for CARES Act and our tracing efforts. So Heather Kerwin helped me with AB 260, and we're going to get some amendments in for that. It's not scheduled, so no need to be alarmed, but it's just an example of how things can impact an agency without intention. So AB 260, AB 30, or I'm going to hold off on that one. SB 318 is another one that kind of negatively impacts us. It's well intended. It's requiring the health district to have every service and everything we do in multiple languages, which is something we attempt to do and try very hard to do in a lot of our activities anyways. But this goes a step further, that we would be mandated to be looking at grants and basically instill a program that ensures that everything is translated. We're going to talk to the bill sponsor. He understands that that would be a pretty substantial fiscal impact to us. So working through that one. There's an interesting one that wants a walkability score done for all urban counties, so Washoe and Clark, that would be tasked to the health districts. That's another unintended fiscal note for us that we're gonna discuss, probably more suitable for an agency like RTC. So I have a meeting with her, with an assemblywoman today to discuss that, as Southern Nevada Health District will be joining us. There's a large bill, SB 275, HIV modernization bill, that will be heard this afternoon. There are several pieces that the health districts are very uncomfortable with that limit our authority to investigate the communicable disease. So we're working through that. Please stop me if you have any questions. There's several housing bills moving along in a really positive way. I can never remember their bill numbers, but I can get them for you. One is just requiring notification to the city that the housing is in before they elect to not be affordable housing anymore, just so we have some sort of understanding of what our inventory is. Very important piece for affordable housing in our community, sponsored by Senator Ratty. We're still working on AB 59, which is the T21 bill, working on amendments to get that bill more enforceable by the Attorney General's office and more effective in terms of consequences for bad actors who still are selling tobacco products to minors. So working on that. And then I'd say that the two big bills that I wanted to maybe possibly have some discussion with are AB 322 and AB 341. AB 322 is allowing for cannabis events to be adjacent to another event. The example used was like Life is Beautiful concert in Las Vegas. The Reno Rodeo was used as an example here. So it would be a separate entrance and a separate event with no food or beverage that would allow smoking of cannabis next to an event. And I think the intent is well-meaning, but I don't think that the bill sponsors or the way it was constructed gave much authority to the locals for permitting and licensure. So that bill got taken off an agenda and put back on an agenda for later this afternoon. But as the health district, whether or not there would be food, if there's hand washing stations or trash, we would still have to monitor those. So we put a small fiscal note that has the cost of PPE and training for our EHS staff. There are some questions about whether or not just the CCB, the Cannabis Compliance Board, could oversee all of those things, eliminating our staff needing to be. I don't know how likely that is of a solution, but that's one bill that we're talking to the bill sponsors about. But in my opinion, I think these cannabis events and lounges are going to pass. So it's a way of how we are going to be comfortable as a health district and as well as a city and cities and counties of how we're going to deal with this. So it's going to be legalized at the state level. It still is an approval process from a city and a county level. So we can have these conversations at a local level, but it's just something to be aware of. AB 341 is the licensure of cannabis lounges. So those could be adjacent to a dispensary or on their own, depending on the licensure. So those are the two, I would say, that are, the most uncertain for our staff to inspect and permit. And, we have city representatives, city and county representatives, and I've just was curious to know the tone of city councils and our BCC about how they feel about whether or not Reno or Washoe County are ready for these lounges to be introduced in our area. I don't know if that's too big of a conversation to have right now, but something to be aware of. So that's my update right now.
Hello, Chair. This is Christopher Dare.
Yeah, thank you, Ms. Goodman-Dotson. I'll look to the board for questions.
Yes, yes, thank you. I want it with the car, the classic car. Could you send some information on that? I want to help get support for it. And so I'm working on that. I'd like to know the language and how that's come through. I know EDON has talked about wanting to support it and some different groups for our air quality. And
sure,
then,
I can send that to you.
Thank you, I appreciate it. And thanks for working through all these bills. I know that that's exactly what you want to do all day long is read all these, so it's a lot of work. When it comes to the cannabis lounges, I think for us, and I have my own personal thoughts or beliefs, but I think it's something that I probably would need to say. I need to kind of go back and let us have a conversation as Sparks go, because I can't speak for everybody on that. So that's just for Sparks. I know, I think I know where some of them land and things, but it's not been a conversation that we've officially had. Thanks.
Thank you.
Chairman?
Yes, please.
Ms. Goodman-Dotson, what was the first bill number that you were speaking to prior to 341? It was AB
322. AB 322 is the outdoor events, and that's going to be heard today at 4.
Okay, thank you.
And before I go, I don't know if there's any other discussion. I just wanted to thank everybody. I know there's been a lot of activity. Jamie Rodriguez sends me fiscal note requests, and there's a very quick turnaround. And so I have to send them out with a sense of urgency. Susie and I send them out to you guys. Everybody that has been getting blasted, Aaron, Jim English, Lisa, Heather, Anna, Nancy. So I wanted to thank you all for getting back to me so quickly. I know it's like, I know you all have a ton of things to do. It's just the legislature works at such a crazy pace. So I thank you.
Any other questions from the board in relation to any of the bills that were stated? Ms. Gutman-Dotson, I know from the city arena, again, as Councilman Dare has stated, I can't speak on behalf of the council and the mayor. If you can please, I know there'd be a lot of conversation with respect to the lounges and also the events, and then as to what that would mean in terms of code operations or enforcements, or any information you have with relation to a memo that I can share with them. I'd appreciate that as well. I know there's been a lot of discussion from just general dispensaries already, and so whatever we can get in front of them, I'll make sure that is translated back to you, so you can have that at your disposal in terms of what we're considering. And I'm sure.
Okay, thank you. I appreciate that. I just wanted to say that because I think City of Las Vegas and Clark County are teed up for this. They're eager for it and they're ready. And I'm not sure that that's where our region is at, but it's coming is what I guess I want to say.
Yeah, no, I totally get it. I mean, a simple question maybe is, just because it's approved by the state doesn't necessarily mean it has to be enforced or given that privilege in a city. And so
Exactly.
we have the opportunity to, walk that as appropriately as we would like to make sure it's done correctly in our city.
Absolutely. I think we definitely have time to really hammer that out up here, how we want it to go up here, but it's coming at the state level.
Yeah, no. Well, yeah, thank you. I'll look out for that memo.
Okay, thank you.
Thank
Sure.
you. Yes, Commissioner, Vice Chair.
And as I look at AB 322, it does, as Ms. Gutman-Dotson pointed out, it does look like it's enabling legislation. And so that gives the cities and the counties a little bit more flexibility. And, I know that this would probably there would be some consternation from some of the rural counties in regards to this ability as well. So even though Clark may be pushing this, they may have some challenges through the remainder of the state, but it is enabling legislation, so that might prove difficult when trying to oppose something of that nature. The other thing I would say, Ms. Gutman-Dotson, my understanding, there's at this time about 1,300 BDRs. We've only had 700 bills drop yet. We still are waiting for the remainder of that 600 to still kind of get introduced from LCB. Is that correct?
That sounds about right. I don't know that all of those BDRs will get introduced. Some of them are from former legislators that lost elections, or some have been pulled. But we will see more bills being dropped, definitely.
Okay, thank you. Appreciate it.
We'll see how many make it through. Yes.
Chair, Tom Young, can I ask one question,
Of
please?
course.
I was curious about this language bill and exactly what this really applies to. Does this apply to only government agencies or medical issues or something there too, this requirement?
So thanks for the question, Tom. This only applies to the health district right now. So it's well intended, and I spoke to the bill sponsor before the language was introduced, and his experience was that he was often the translator between him and his father's providers as a really young kid, which is pretty inappropriate. And I think has largely to do with the COVID response is, are we doing contact tracing in Spanish and other languages necessary, which we are. We have translation lines, But I think he'd like to take that a step further if he could and have actual certified staff for everything we do at the health district. So that's pretty far reaching. And it's something that the health district would love to do. And it's something we think about. It's just mandating that we follow through with all of these grants that you can't guarantee that we would win is staff intensive. So just there's ways that maybe this could be a may instead of a shall, and, documenting what we already are doing and what we could be doing better. But the way it's written now, it would just be an expensive task for us at the moment. There's another bill, AB 177, that requires prescriptions to be written in your native language. And that is something we support. Direction should be in your native language, but the Retail Association is strongly opposed to that. So we'll see.
Well, how many languages would that include, though?
Well, that's where, you have to limit it. It can't be like a native dead language, but how about, the 5 most spoken languages in your community, something like that. Mm-hmm. Yeah.
Okay.
Thank you for the question. Any other questions? See none. Thank you very much. Chief Brown, did you have something to say? I saw your lips moving. Okay.
I'm good.
Thank you, sir. With that being said, thank you so much, Ms. Gutman-Dotson. Any public comment with relation to this?
No registered public comment, Chair.
Thank you very much. We'll go ahead and close item number 11. And we'll get back onto to item number 7, presentation of the Washoe County Health District's response to COVID-19 pandemic. Mr. English and Ms. Kerman.
Good afternoon, Mr. Chairman and members of the board. This is James English, and I'm also here with Ms. Heather Kerwin. And at this point, I'll attempt to share my screen for our PowerPoint presentation. Hopefully everyone can go ahead and see the cover slide.
Not yet.
I am...
Go back to Zoom.
Mm-hmm. And select the PowerPoint.
And for all those watching at home, the PowerPoint will be uploaded after today's meeting on our website.
All right, are we good now?
Yes, we see it.
All right, so I'm James English, Washoe County Health District employee. I'm also serving as the Regional Incident Management Team's operation section chief for the incident management team for COVID response. And with me, I have Heather Kerwin, who serves as the epidemiological group lead for this response. What we're going to go through today is the health branch response and the funding related to the region's response. The major components for the health district are the epidemiology component, which is the key to this entire operation. It is, we consider them, or I consider them, our unsung heroes. They help give us the direction and guidance on where to go, both with testing, contact tracing, and also which populations to target for vaccinations. We also have the testing, which is our post and our vaccination sites, which are our pod. Those are our public facing operations. And then we have the large call center, which is basically our equivalent to a central command for this entire operation. The challenges, as with any emergency response, really are communication in rapidly changing environments. We, as we've seen throughout this year, we continue to see changes and adapt to them as necessary. Another large item that we've had to challenge in this event, which typically wouldn't happen in other emergencies, is the politicalization of the infectious disease and the actual response itself. But what you have before you right here is one of the very first incident command org charts. We moved into the incident command structure as just the health district on February 27th. We requested the county activate level 1 at the EOC at that time. We at that point had the health officer as the incident commander, and on March 5th of 2020, that was transferred to Charlene Albee, who has since retired. On the 6th of March, we had our first post where we did our first testing, and that's the photo you see there. Also later, you'll see a sketch from the evening of March 5th where staff figured out how to do the first large-scale testing for COVID-19. This slide right here is basically the health branch and the first day of the incident management team. As you'll recall, the health district realized after the weekend of the 13th, we needed a lot more regional support. We requested a unified command, and that unified command was put in place on March 20th, 2020, and we're still in that at that point in time. And for those of you that are unaware, that's a delegation of authority from the cities of Sparks, City Arena, Washoe County, and the health district to the incident commander for this event and this response. Since then, our first incident commander was Battalion Chief Sammy Hicks. We have then transitioned in May to Washoe County's emergency manager, Aaron Keniston, who has since retired. And on the 4th of January 2021, we transferred command to Mr. Dave Solaro, who is also an assistant county manager at the Washoe County Health District. This is the overarching incident management team structure. And what I'd like to point out is at this point in time, all the command staff positions are filled with Washoe County employees outside of the regional section chief, which is Chris Megenheimer. He is under contract through Washoe County Health District, has been with us since March of 2020 when the IMT first brought him on board. He serves the dual role of both planning for the health branch and for the region. He's paid out of federal emergency preparedness funds and continues to contract with us. Most of these names, you'll see there's people filling multiple roles. We're about as lean an operation as you could probably have for this scale of a response. And I would like to highlight Aaron Keniston had requested the enforcement branch, which was ramped up in November of 2020. So I'm going to quickly go through here. The health branch has multiple operations. Obviously, this is the pod operation where all the vaccinations are given. In March of 2021, we added a technology group that is trying to bring on the new scheduling system. And also, we have a tremendous amount of technology, both at the pod, also at the post, and internally here at the health district. And I would like to thank Washoe County TS, who ramped up a team in November to assist us. We have the outdoor pod. This is the org chart, but it also is a flow chart to show you how vaccinations go through the process out there at the public facing location. And then inside, this is the testing pod or the post as it currently is. And I should point out on all these slides, when it says ×5, that's the number of employees or personnel in each one of those positions. So with that, I'll turn it over to Ms. Kerwin to continue on.
Good afternoon, members of the board. This is Heather Kerwin. For many of us, it's been a very long year, a continuation, but I did want to call attention that our epidemiology team here at Washoe County Health District has actually been involved with the COVID-19 response since the very latter months or weeks of January of 2020. We attended the daily CDC emergency operation calls starting on the 21st of January of 2020. And that is actually when we did our first media interview on the novel coronavirus, where very much of what we know today was unknown at that time. During the month of January and February, we were asked to monitor many travelers returning from China predominantly. The source of infection had been traced back to there, originated from there. And we did not have approval to be testing for SARS-CoV-2 at that time. So anybody who came back with symptoms, we actually had to call the Nevada Department of Health and Human Services, request a call with CDC and ask permissions to test. We did that 11 times over the course of January and February, with only 3 of those 11 having given permission to be tested. All 3 of those did come back negative. we were fielding, our epidemiology program was fielding hundreds of calls a day. So we actually onboarded the rest of our epidemiology and public health preparedness division to help us. We did our first collection for SARS-CoV-2 on the 26th of January. And then shortly thereafter, we started doing our first press releases, internal meetings, and external meetings with our partners. I host a meeting every Friday and have not missed a single Friday with our partners, and that involves our first responding agencies, our hospitals, local community providers, and now includes partners in vaccination, as well as others in our community. March 2020 was one of the busiest months, I think, of our entire pandemic response. That's why it gets its own designated slide. Our call center was stood up because we were fielding over 250 calls a day. We had, of course, our first confirmed case on March 5th, and that was a Grand Princess cruise passenger who had disembarked and then developed symptoms. And so it was very clearly linked back to that. During March, right after that first positive, we actually stood up the first drive-through testing site in Nevada, our post. And this post has been used as training grounds for posts all over the country. We also created our first incident action plan. We had very limited specimen collection devices, so we had hundreds of people requesting to be tested a day, but we're only to test a handful, sometimes maximum of 50 through this early times in March. It was very frustrating. We had to triage by hand who did and didn't get a test based on epidemiological risk factors. The 13th, of course, was when this, Governor Sisolak did declare that stay-at-home order, and we start looking at our shortages and our PPE and what we couldn't provide to our healthcare workers. It was a lot of change and a lot of things being stood up all at the same time. We were scheduling our tests manually. We were referring contacts to cases and calling them. We, in the epidemiology program, were monitoring travelers returning from over 130 flights. So this was monitoring not just 130 people, but travelers returning to the Washoe County area with over 130 flights being monitored. And we had to recruit several members from other divisions during that time. The next 3-month chunk of time here from April through June, our Nevada National Guard, Air and Army National Guard were deployed with us and still remain with us to this day, for which we are very thankful. We would not be able to do what we have done to date without them and many other volunteers and organizations that have been deployed federally as well as statewide to assist us and other local health departments across the state. We had, towards the tail end of April, 47 health district staff that we pulled from environmental health, our sexual health programs, and other areas. Our big accomplishment for technology, shout out to Amber English, who worked diligently to get the Acela system, which used to be a naughty word around here, but stood up and helped us automate our risk assessment process to be able to get all of our scheduling for tests through the post done in an automated fashion, which alleviated a lot of that manual labor that staff were doing. Towards the beginning of June, our epidemiology program actually identified the first documented reinfection case in the United States, and the publication that resulted in conjunction with the Nevada State Public Health Lab, who are, we are eternally grateful for as well, is actually among the top 10% of downloads in the Social Science Research Network through to today. We did transfer our incident command from Sam Hicks to Aaron Kenniston at that time and put a contract in place with UNR to begin mass hiring. We brought in at the beginning of July 30 new disease investigators through the UNR contract, and we began to train them. We also started expanding our full-time kind of permanent staff, grants coordinator, office support specialist, and administrative assistant 1. Our call center expanded to 7 days a week with extended hours. And we transitioned at that time to who our current health branch command is, Mr. Jim English. Over the course of October through December, we had our environmental health staff began their Senate Bill 4 inspections. And we had our largest case surge to date start occurring over the course just around the Thanksgiving holiday there, we had our 2 highest case counts per day back to back there. And we had to really ramp up our operations as well. We were pretty maxed out on that. Fortunately, the vaccine was in play. On the December 22nd, we got our first shipment of Moderna. And around the same time, our contract with Deloitte ended, and we in our epidemiology branch began conducting a contact tracing again. The first part of 2021 seems to be hopefully the beginning of the light at the end of the tunnel. Our transfer of incident command went from Aaron Keniston with his retirement to Assistant County Manager Dave Solaro. We began ramping up our vaccination as vaccines became available. And towards the beginning of February, we had already provided over 30,000 total doses of vaccine. We then, between about a month-long period between February and March, we have identified 2 of the 3 predominant variants of concern. We also received our first shipment of the Janssen vaccine and now have surpassed over 50,000 vaccinations here at Washoe County Health District. Our call center in the next couple of slides really show the transition from where we began to where we ended. So in March 2020, we were running a call center with 4 to 6 personnel, fielding about 200 to 400 calls a day, doing everything very manually, calling people back, filling out risk assessments using SurveyMonkey tools. Now, here in March of 2021, we have 36 personnel, 370 calls a day as an average for us, with a high of 662. They're answering questions from citizens, business, public, private facing entities on all sorts of questions COVID, not just about testing. They are working through scheduling people. They are doing all the documentation preparation for the post and the pod. And now they're dealing with a lot of vaccine data and data entry as well. This is what it first started like in March 2020. And this is now over in Building D. We have expanded across our entire county complex here. We have since moved into Building A and C as well. And that is what our call center looks like today. So we're all grown up. For our post, we started with our community and clinical health services folks working about 7 to 10 a day doing the swabbing and nasopharyngeal swabs through our tuberculosis location clinic just south of our main complex here. We were testing between 10 to 100 people a day, super limited in specimen collection kits, our staff, our space. We had sent all specimens to the Nevada State Public Health Laboratory. We've been in tight collaboration with them since the beginning of this and continue to do so. Now at our post, we have 41 people staffing at any given time. We have 10 medics that support testing, but we only are requiring 2 at a time. We have the capacity to test up to 900 people a day if needed. We hope to never get to that place again, but we have the ability to do so. We also stood up one of the only homebound testing, earliest homebound testing with REMSA. Huge thanks to them being able to help us out with a lot of that as well. And we have worked now with 3 different labs, although predominantly are working with, again, Nevada State Public Health Lab as well as Charles River Laboratory. For a moment used Quest. And Jim, I think you maybe want to touch base on our fancy version there, the draft up in the top corner.
So the draft is a sheet of paper that Julie Hunter worked on way back on March 5th of 2020 on how to do the first drive-through post testing. And there is where we have landed today with an aerial photo of our post, which also is utilized as our pod. But there has been some discussion that we were the first drive-through testing site in the United States. And our UNR students that did volunteer here last spring did publish a paper on that and the evolution of our post.
Our epidemiology program has come an equally long way from March of 2020. The EPI program actually had just 4 of us in place, in addition to a statistician and office support specialist, and grew quickly to 25 staff, primarily our EPHP division. quickly added on our environmental health services, sexual health program staff. And our priorities every day, we're finding every single case and completing 100% of the contact tracing efforts for all reported cases by end of day, which sometimes would be 10 or 11 o'clock at night. Now, March 2021, fast forwarding a year, we've got 75 staff. We have our 11 National Guard who have been deployed with us, 49 UNR contractors that we refer to as our disease investigators. We have 5 disease investigators with a temp agency, admin staff, data entry staff. And in addition to doing the above, which was finding every case and completing contact tracing efforts for each day, we are also now identifying reinfection cases. So those are people who have been infected once before and are now infected once more. We are identifying breakthrough infections, which means someone who is fully vaccinated more than 2 weeks, at least 2 weeks or more since their final dose in the vaccine series, who do also go on to develop symptoms. Fortunately, there are very few of them, and very few of them are symptomatic. And then, of course, the one that keeps, unfortunately, driving our numbers are these new variants of concern. They are labeled as such by CDC due to their infectivity rates or their the ability for them to somewhat evade vaccine protection. And we get all those sequenced in conjunction with the Nevada State Public Health Laboratory, so very reliant on them to help us do our jobs well. This is a picture of me putting together my org chart in a visual way using fancy Post-it notes back in May. And this is a training that I held just yesterday for our disease investigators in the BCC, where you're sitting now. And working through new developments because we're constantly changing. This is just a breakdown visually of our COVID case count by month. As you can see, we hope to never revisit the numbers we saw in November and December. Those 2 months alone account for cumulative, half of our cumulative cases to date. And we hope that with our community increasing the vaccine efforts collectively, and everybody who can and is willing and able to get vaccinated, being vaccinated, that we never reach those numbers again in our community. Our largest accomplishments within our EPI unit is having trained over 175 staff to do COVID-19 disease investigations and contact tracing. We've shared processes and protocols with neighboring jurisdictions as well as nationally. We created the slide deck and the recording for the COVID one-on-one training that we provided to the UNR Public Health Training Center, who has now trained over 500 personnel that are deployed all across the state using those resources. And in partnership, again, huge shout out to the Nevada State Public Health Laboratory for all of their work in genomic sequencing and genetic typing so that we can continue to do the best job that we can.
So from there, we'll go over some of the major accomplishments of the post. And the photo you see there is from the very first mobile post we held, and that was at the Reno Event Center for the unhoused population. We did that at the request of the VOA. That was very successful. Since then, we've gone into both skilled nursing and assisted living facilities and continue to offer mobile testing as required or at the request of our epidemiological team. Furthermore, we have done over 69,000 tests at our various post locations, and we've moved 5 times in conjunction with our LEC to help them continue to do some operations. This post does not run without the assistance of UNR, the MRC, the CERT volunteers. We had Team Rubicon out there for the first few months, in the Air and Army National Guard with the state of Nevada. Talent Framework produces temporary staff for us, and we also have RIMS as assistants. The call center's largest accomplishments to date are they have had over 197 people work in that call center assisting us. We have used various departments within Washoe County, UNR staff. We've used light duty workers from the city of Sparks and the city of Reno when they've had them, and UNR contractors. We have promoted, I'm really proud to say, we have promoted 21 personnel within this emergency response operation, kind of following professional development of staff. When we've seen staff that can handle a larger role, they've been promoted from either the poster pod into the call center or actually into the disease investigation unit. Furthermore, our call center actually expanded from 45 hours a week to 86 hours a week, and they speak multiple languages along with our disease investigation team. Largest accomplishments to date, this slide just recently got updated and we continue to add more vaccinations, but on the 20th, we surpassed 75,000 total vaccinations dispensed at our pod. Our homebound vaccination process is the first one in the state of Nevada to ramp up. We've been doing it in excess of a month. We partnered originally with REMSA. We appreciate all their support and assistance with this and our mobile in-home testing. We are now moving our homebound vaccinations to within the health district, and we will start providing them 7 days a week. We also go to skilled nursing and small assisted living facilities as necessary to assist. So this is the first shipment of vaccine for our region. Many people ask, this is the inside of our refrigerator, our walk-in refrigerator where the vaccine's actually thawed. You can see how it's labeled with all the dates. And those are the small vials of Pfizer you see there. And then this was the first day Washington County Health District provided the first shots to the community. As you'll recall, Renown utilized our location, which was great for us. It allowed us to work out all the operational kinks before we took over and started mass vaccinating. So many individuals have been asking about the funding and how we're doing this operation. Here at the Health District, all this funding is coming through various federal grants. To date, as with most government operations, the bulk of our expenses are in staffing. In the past year, we've spent $6.9 million on staffing for this response. We have spent another $4.6 million on our exterior post and pod operations here to support the region. And of course, that continues to allow for free testing and vaccinations for our community. And that's the outward facing operation. We have spent another $800,000 within the Washoe County complex on computers, software, workspaces. For those of you who may not know, we have moved into almost all of the north end of the Washoe County complex. We're in the old Truckee Meadows Fire Rescue areas. We now use the old cafeteria as a secondary storeroom. We took the central conference room and converted that into workspaces, and we moved into where previously the state of Nevada had various caseworkers for adult services. So we have slowly grown, and what the community really probably doesn't realize is the health district staff has been working on site since the beginning of this pandemic. Going forward, we have currently spent out $1.6 million in grants, and I fully anticipate over the coming months, we will spend out the ELC Enhancing Detection grant will continue on through this year, but the COVID relief funds and the ELC CARES are quickly being closed out over the next couple of months. Furthermore, the public health preparedness grant, the $935,000, that's covering most of our temp staffing at the post and the pod. We have two additional grants that are coming on board. One is the ELC Enhancing Detection and Expansion, which is $15 million, and that'll be utilized by the health district over the next 2 years for this response. Furthermore, we were just awarded the vaccination program grant of $3.8 million. The state retroacted that date back to July of 2020, but really we only got the scope of work and funding allocation in February. So we will be moving forward with that. Also, since we're in an emergency response operation and still using ICS, all purchases and requests are funneled through that system. They all come across my desk where we vet them on whether or not they're necessary and how best to utilize our funds here at the Health District. I appreciate everyone continuing to utilize the ICS system. It's worked very well for us, and also for Washoe County Health District's admin team that has been great support as we also work through the proper federal grant requirements and Washoe County Health District and Washoe County purchasing requirements. So the Enhancing Detection Expansion Grant, which is the large one that will continue our operation going forward, it's supporting all the positions you see here. The one thing I want to highlight is the Washoe County Health District, it has or is in the process of actually increasing its staffing by 8 full-time FTEs. but the bulk of this operation is being run by highly trained staff that are temporary, and that equates to over 88 FTEs here. That has been a moving target for us and a huge workload on our staff, especially the epidemiology group, because they do most of this training along with our call center staff. But this will allow us to either ramp up or ramp down depending on how this pandemic continues in our community. And hopefully it is a ramp down. The vaccination grant is funding, we'll be funding a new public health nurse, a public health educator, and an office assistant. And those will be permanent full-time positions here in the health district. The main reason for that is that as we move past this initial response and push for vaccinations, the health district's role will change as related to vaccinations. And I just want to highlight that we will be ensuring that vaccinations are done in a high quality and safe administration. Our CCHS staff will actually have to go out and do compliance visits of all community partners providing vaccine. Currently, right now, we're doing that with our fire partners. We're providing support to them, education, and doing on-site audits. Furthermore, a large request and requirement of this grant is to make sure there's an equitable distribution and administration of the vaccine. I personally think the Washoe County Health District and our Washoe County staff, along with the regional response and JIC teams, have done a very good job with the outreach. We continue to message the best we can and use all our regional partners and assistants and our nonprofit groups. And then we will continue to do education with the new health educator to build confidence in the vaccine so more people do it. So with that, I really need to thank all our volunteers and all the staff that work on this response and have been here for the last year. You have a photo there of the guard at the end of one of the testing days a few months ago where a local group and staff partnered to bring lunch to them. The middle photo is our health officer providing a challenge coin to one of our captains who just recently left, actually back in December. He saw the last move of the post and the setup and operation of the first vaccines. And then the third photo is actually one the guard gave us when they actually thought they were demobbing last June. And of course, we all know they've been now extended through May, and we cannot do this operation without them. They are the one group that we can always rely on to be out there no matter what the weather is and have a can-do attitude all the time. So with that, we'll open this up to any questions anyone may have for either Ms. Kerwin or myself.
Thank you very much for that very thorough presentation. I'll look to the board if you have any questions for Mr. English or Ms. Kerwin.
Hi, Chair. This is Christopher.
Yes, Councilman.
Yes, I think it's amazing when we lay this out in this fashion and look at the work that has happened over this last year. And I just want to say how amazing it is. I know that looking back, I'm sure these guys have areas that they think they may be able to improve on if they only knew, but it's hard to think of that way. So I don't know, I think my hat's off to the work that's been done, and I know we have a lot of roads to come and decisions to be made, but good job. That's what I want to say.
Thank you for those comments. Anyone else from the board? Anyone else? Exactly to what the councilman stated. Thank you, Mr. English and Ms. Curran. Please give my sincere thanks and appreciation to the team out there. I haven't had a chance to really visit the pod and see all the work that's been happening outside and all I hear are great things. All I hear are great comments. And I constantly am out there sharing with the community that we are definitely one of the best in the entire country in terms of how we're doing this. There's a lot of frustration in our community about wanting to move things quicker and sooner, and everybody has a thought or an idea, but we are doing an exceptional job in comparison to what others are experiencing in other parts of our country. So my hat's off to the entire team, and the constant ability to innovate and be creative to get out more efficiencies and get the vaccines out, including our testing. So thank you. Thank you, Mr. District Health Officer, your leadership as well. Anyone else on the board care to make any comments in relation to the presentation? Seeing none, do we have any public comment?
No comment, Chair.
Again, this presentation will be uploaded to our website for all those that are watching on Zoom. We'll close item.
Thank you.
Thank you. Thanks, you guys.
Thank you.
We'll close item number 7. We'll move on to item number 8, the Regional Emergency Medical Services Authority. Item 8A, Mr. Dean Dow.
Good afternoon, Mr. Chairman, members of the board. For the record, Dean Dow, President and CEO of REMSA. In CareFlight, you have received a copy of our February compliance report for your review, and I'm available for any questions.
Any questions for Mr. Dean Dow from the board? Seeing none, can I get it's a presentation. Do we need a formal vote on this? Yes, can I get a motion, please?
Brown will make a motion to accept.
Motion. Do I hear a second?
Second, Young.
A motion, a second. All those in favor, aye?
Aye.
Aye.
All those opposed? Motion carries unanimously. Thank you very much, Mr. Dow.
Thank you.
8B, Ms. Jobson.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA, for the record. Of course, you have for your review the Public Relations Report for February, but I also have a few more recent updates to share with you. In mid-March, REMSA was included in an NBC News digital story about the importance of properly navigating patients to the right level of healthcare, a critically important need that the pandemic certainly brought to light. REMSA and the Washoe County Health District were featured in a positive news story on KTVN about the homebound vaccination program that you just recently heard about. And finally, REMSA's Center for Pre-Hospital Education launched Grand Rounds, which is an educational opportunity that takes a more in-depth look at topics relevant to out-of-hospital healthcare presented by subject matter experts. The Grand Rounds is open to anyone. However, healthcare providers of all levels and from different settings will find the subject matter particularly relevant. It's offered monthly. People can register on our website. It's free and offered virtually. I'm available to answer any questions you might have about the public relations report.
Any questions for Ms. Jobson, please, from the board? Seeing none, do we need to take a vote on this or just accept? Okay. Thank you so much. Appreciate it.
Thank you.
Thanks for the heads up. We'll close item 8B. Again, item 9 was tabled for April. We'll move on to item number 10, presentation of possible acceptance of the 2020 Community Health Improvement Plan. Ms. Lavoie, are you with us?
I am here. I'm going to go ahead and share my screen. Can everybody see my screen?
Yes, we can.
Okay, wonderful. So good afternoon, board members. My name is Rayana Lavoie, and I am a health educator for the Office of the District Health Officer at the Washoe County Health District. Today, I'm going to present a summary of the 2020 Community Health Improvement Plan Annual Report. Throughout my presentation today, I will be referring to the Community Health Improvement Plan as the CHIP. The CHIP is a community-driven improvement plan. However, the Washoe County Health District is charged with collecting data, tracking the progress of activities that live within the CHIP, and preparing the annual report. The annual report is a highlight of the activities accomplished by working together to impact the community's health with our partners. In the later half of my presentation, I will also talk about the goals moving forward. The 2018-2020 CHIP has 3 focus areas, including housing and homelessness, behavioral health, and physical activity and nutrition. The pie chart that you see up on the screen is a visual representation of the progress accomplished in implementing the CHIP strategies over the course of 2020. In total, there are 18 strategies, and each of the objectives have strategies and specific tactics that correspond with the focus areas and give our committees their to-do work. In 2020, we are proud of the work that was accomplished as many of our partners were learning how to navigate their way through the pandemic while simultaneously moving efforts forward to improve the health of our community. We met with our community partners through CHIP subcommittees virtually, and we do this quarterly. Our first focus area is housing and homelessness, and the committee made progress achieving one of the 3 strategies. The regional strategy for housing affordability that was led by Truckee Meadows Healthy Communities and developed by stakeholders across the community was adopted region-wide. Activities from this objective are being looked at for further implementation in 2021 because there's still a need to identify a lead organization who will implement the strategy that has been developed. This effort will be critical in meeting the housing needs in Washoe County. Another activity outlined in the regional strategy that has been implemented include efforts to improve the preservation of affordable housing. This strategy aligns with SB 12, which was introduced and heard during the current legislative session, and if passed, the bill would require certain notices before the termination of a restriction relating to the affordability of certain housing. Also, in 2020, the Washoe County Health District awarded funds to the Eddy House to increase the number of transitional aged youth served through their community-based living program. This program focuses on bringing youth out of crisis and transitions them into stable housing. The Eddy House saw a total of 475 youth. Of those individuals, 43% had an increase in employment and 18 individuals transitioned from their community-based living program into stable housing. The second focus area is behavioral health, and the committee has made great progress on 9 out of the 11 strategies. Starting with GoodGrid, a universal case management system for providers who deliver behavioral health services, has been implemented with Phase 2 partners. This is an ongoing effort to continue to streamline screenings and referrals for treatment services for those individuals who need it. 7 out of the 10 partners are using GoodGrid at varying levels and have reported many successes in utilizing the system. Another accomplishment to note is the progress made on the Signs of Suicide program, which was an opt-in program. In prior years, a consent form would be sent home with students to get parents to provide consent to participate in the program. A large proportion of those consent forms wouldn't get returned to teachers for various reasons, which limited the number of students participating in the program. As a result, to increase awareness about the program, the permission slip was included in the student enrollment packets for 7th grade so that parents see the form, and it's now an opt-out program. Last but not least, the behavioral health efforts focus on our senior population. This was included when CHIP 2.0 was adopted, and this is because in Washoe County, the suicide rate for people 65 years and older was twice the national average, and for those 85 years and older, the rate skyrocketed to 4 times the national statistics. So the Hello Project focuses on engaging seniors through connections. It starts with Hello as a virtual gathering held every Tuesday and Thursday via Zoom, and this meetup features local experts who offer input on all things affecting seniors, including health and wellness, local resources, and just ways to stay connected to others, like local news and finance advice and policies and politics. The other successful activities out of the Hello Project include the Hearttown Project, where seniors were able to design a wooden heart, which was displayed during Arttown's gallery in July. The last CHIP focus area is physical activity and nutrition. The committee achieved or made progress on 4 out of the 4 strategies. The 5210 Healthy Washoe Committee worked together to provide a series of trainings to pilot sites who were implementing the program. The largest training provided was through Washoe County, where we engaged all 24 departments. The training focused on teaching participants about conducting an environmental scan to determine what wellness looked like for their department, goal setting, and increasing awareness about the program. Several departments had a kickoff to launch the program, and as for the health district, we organized salad bars that were hosted by each division. Northern Nevada Hopes was one of our healthcare pilot sites. They started integrating the Healthy Habits questionnaire during pediatric visits to incorporate conversations with families about healthy behaviors that support physical activity and nutrition. The pilot project was a success, so they expanded their efforts to focus on the employee aspect of the 5210 Healthy Washoe program. The Family Health Festival Committee continued to implement events and modified the festivals to be done through a drive-through. About 7 of the partners provided direct services on site, and for those who were unable to attend, they provided information for the resource bags that were handed out to every family who was on site. The number of attendees at the events are on average around 500, but in August and October, those numbers nearly doubled. So as we look ahead, we're going to continue to implement the strategies and tactics outlined in the 2021 CHIP, and we're going to continue to meet with our CHIP committees to get that work done. Again, the 2020 annual report is a year of collaborations between the Washoe County Health District and community partners. We want to thank them for their dedication to making Washoe County a healthier community. And with that, I'll take any questions that you might have.
Thank you, Mrs. Lavoie. Any questions from the board? Mr. District Health Officer.
Yes, thank you, Chair Delgado. I just wanted to comment that obviously the CHIP implementation was impacted by the pandemic that we're going through. And I think it's remarkable that our partners were able to continue and make so much progress in working with us where we did make progress during the year. I would note that one of the areas that we made some of the least progress was in the implementation of the regional strategy for housing affordability. And while the region is taking great steps forward with the unsheltered population and the Nevada Cares campus that's being constructed currently, I know that in the federal stimulus funds, there are significant amounts of funds that are coming to each of the cities and the county. And so I'm hopeful that there's an opportunity there to revitalize the efforts to address affordable housing, which we know has become even more of an acute issue as a result of the pandemic. So I just wanted to comment on that. Thank you.
Great comments, and I agree with you, Mr. District Health Officer. It's there's so much emphasis that's put on the CHIP, not only by the health district, but by other community partners. It's what's a lot of community partners utilize as part of their grants applications. It's what a lot of people use in terms of just setting benchmarks, and appreciate you, Mrs. Lavoie, and all those that have worked on the CHIP to keep at as best we can under the circumstances that we're under. It's great to see how much we've been able to accomplish understanding our current situation. Is there any other board members that would like to share any words? Seeing none, do we have any public comment on this item?
No comment, Chair.
Ms. Lavoie, you have anything else to share?
I do not at this time. Thank you.
Thank you again for the presentation. We'll go ahead and close that out. Is there an action on it? Do we need to take a vote on this? Yes.
It's motion to accept, yes.
Motion to accept. Can I get a motion to accept from the board, please?
Brown, motion to accept.
Motion to accept.
Second.
A second. All those in favor say aye.
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 All opposed? Motion carries unanimously. Thank you again. Moving on to item 11, discussion possible direction from, oh no, we did that one already. Thank you, Mrs. Goodman-Dotson. Item number 12, staff reports. Mr. District Health Officer.
Thank you, Chair Delgado. First, we have air quality management. I believe we have Francisco. Yes, we do have Francisco Vega joining us via Zoom for air quality management.
Thank you. Yeah, thank you, Mr. Health Officer. Mr. Chair, members of the board, for the record, Francisco Vega, Director of the Air Quality Management Division. Before I turn it over to opportunity to ask questions, I did want to give an update on the classic vehicle legislation. I know Ms. Gutman-Dodson had touched on it, but I did want to provide some more information to what I had provided in my director's report. The bill was introduced on this Monday, March 22nd as AB 349. The bill was then referred to the Committee on Growth and Infrastructure. As currently written, the bill revises several sections of the provisions governing vehicles. This includes removing the exemption for certain vehicles from the provisions governing the control of emissions from engines, provides authorized inspectors the flexibility to work at other inspection stations and class of inspection stations, exempts new motor vehicles from emissions testing for the first 4 years of the life of the motor vehicle, removes the ability for the State Environmental Commission from issuing a certain waiver to the owner of a motor vehicle who performs repairs on that motor vehicle, and increases fees for emission testing stations and forms certifying emission control compliance. So again, just wanted to mention that as we know, emissions from the transportation sector continues to be a significant source in the region, and this legislation has the potential to significantly reduce those emissions. So we will definitely be monitoring closely. With that, I'd be happy to answer any questions.
Any questions for Mr. Vega? See none. Thank you, Mr. Vega. Appreciate it. Item B, Ms. Loretz.
Good afternoon, Lisa Lotritz, Division Director for Community and Clinical Health Services. I just wanted to mention our division update this month was for World TB Day, which was yesterday. And I wanted to thank our TB staff for all of the work they do every day. And they do act as experts in our community regarding TB and are often called upon from providers and others in the community because they are the ones that know this disease the best. And also wanted to mention that our sexual health team are now back at the Washoe County Sheriff's Office providing testing on a weekly basis. So we're glad that we're able to do that again. And then we're also providing community testing over at the Senior Center. And we are just waiting to get our family planning staff back up in the Sheriff's Office as well. That's all I have to add, but I'm happy to answer any questions.
Any questions for Ms. Lodritz? See none from the board. Thank you so much for your report. Item 12C, we have Aaron Dixon, please.
Good afternoon. For the record, Aaron Dixon, Washoe County Health District, Environmental Health Services. Just a few things I'd like to highlight and the one quick update. Do want to recognize Mark Dugan. He was for his retirement, he was a very integrated part of our team and he will be missed. I want to update also on our SB4 inspections. All 17 of our second round inspections have been completed. One facility did meet all the minimum requirements and no violations were documented for that one facility. Our team is actively working on the special events plan reviews as they come in. They're working very closely with the state and our regional partners on those special events plan reviews. And then just finally, just a reminder that this is Washoe County School District spring break, but after that we'll be finalizing and finishing up all of the school inspections and the school kitchen inspections prior to the end of the school year. So that is it, and I am available for any questions.
Any questions for Ms. Dixon? See none, great report, thank you very much. We'll close item 12C. Item 12D, we have Dr. Dow.
Hi, good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director for Epidemiology and Public Health Preparedness. I don't have anything in particular to add to my division report. I do want to add that our contact tracing efforts are now with the Washoe County School District for school-related contacts. It lies with our strike team as of March 15th. Also, our influenza surveillance and prediction presentation that's now moved to be presented in April. So in the meantime, I do want board members to know that we send out weekly reports that updates ILI activities throughout the season. So if you would like to be kept in the loop about ILI activities and see our reports on a weekly basis, please do let us know and we will add you to our email list. That's all. Thank you. And I'm happy to answer any questions you may have on our report.
Thank you. Any questions for Dr. Dow? See none. Thank you for the report, Dr. Dow. Appreciate it very much. Item 12E, District Health Officer, Mr. Dick.
Yes, thank you, Chair Delgado. Just on the COVID-19 response, just wanted to comment on the presentation that we heard from Mr. English and Ms. Kerwin. Obviously, a tremendous amount of work and effort that Health District staff and our partners have devoted to this. And we're quite fortunate to have Ms. Kerwin and Mr. English involved. They are some of the strongest, hardest working people I know, and just have been given this their all. Heather for over a year now, going back to the January days when this started, and Mr. English since he assumed the ops section chief position the end of September. So very grateful for those efforts. The vaccinations, just to provide an update, we're at 181,461 doses administered for Washoe County as a whole. So that's 23% of the population that's received their first dose, and 15.6% of our population that's fully vaccinated right now. And the test positivity rate, I had mentioned that it had dropped from 8 to 5%. Unfortunately, we did not go below 5%. We flattened out there, and we're currently at 5.2%. So we would have liked to have seen that positivity number continue to decline, as we've seen it has happened in many of our counties. We do have B117 variants that the State Public Health Lab is detecting through their genomic sequencing, and we're reporting 31 additional B117 variants that have been identified that the lab reported to us today. So that brings our Washoe County total to 45. So that's the variant that originated in the UK, is more transmissible and has a higher mortality rate. So it's not surprising, though. This is what has been spreading in Europe, and it's been predicted to become the predominant variant that we'll be seeing for cases of COVID-19 in Washoe County. I'd also then like to just summarize the information as far as my response on the January 20th, 2021 concurrent meeting that I included in the report. Vice Chair Lucy had asked me to provide this. And to summarize from some of the issues that were discussed during that meeting, and the composition of the board and the number of electeds on the board, and if that should be increased. Since that meeting, the Board of Health has appointed 2 electeds as the officers on the board, Councilman Delgado and Commissioner Lucy as chair and vice chair. And so I think that's been a responsive measure to have elected leadership on the board. Also discussed was industry representation and how to have their voices heard. So I think it's positive that we do have appointed members on the board that are an opportunity to have representation of some of the industries that we deal with and or regulate. So I think the Chief Brown obviously brings a wealth of information and knowledge regarding EMS and emergency response type activities. Mr. Young, being a restaurant owner in the community, is one of the industries that we regulate quite a bit. And we are working to revitalize some of the efforts that we had previously that were diminished as we were going through the pandemic response to reconnect and have regular meetings with the Builders Association of Northern Nevada, the associated contractors. Ms. Dixon is working also to get a meeting with restaurant group and the Resort Association as well, to be able to liaison with some of those industries to make sure that we have good communication and are able to address their issues and concerns. One of the issues that was raised was the age of the interlocal agreement, and that it had been a long time since it had been amended. Under the interlocal agreement terms, we've been bringing that to the board on an annual basis for review and to see if there's any recommendation for amendment to the interlocal agreement. As we were doing the response to COVID-19 this past year, that didn't occur. So I apologize for that oversight, but we'll bring that interlocal agreement to the board. June, it was in June 2019 was the last time the board reviewed that. So we'll get back on track with that on the agenda for the board to be able to discuss during the June 2021 meeting. We presented to the board the appeals process that we use in air quality and environmental health at our previous board meeting, and we've worked to try to make that more understandable to the community with some graphic representations and flowcharts, and have posted that information on our website as well. Following the last meeting, I did share with the board the membership of the different appellate boards that we have, and all of the appointments on those boards are current. They've been coming to the board for those appointments for the membership. But I would note that the Food Protection and Hearing Advisory Board is a board that doesn't have term limits on it. And so some of those board members were appointed by the District Board of Health many, many years ago. And so if the board would like, we can work to address that. It would be an amendment to our regulations to set term limits for that, and we could address that moving forward. The other issue was on the name of the health district, and concerns about that it was the impression that it was something that was fell under the oversight and direction of the Board of County Commissioners. And so I think that's certainly something that could be discussed and could take action on if it's determined that that's the best course of action, or if there's other ways to help clarify. This is a separate governmental entity that is regional in nature and operates under the direction of the District Board of Health. The issue of communications was raised, and the feeling that there wasn't enough communication from the health district. And I understand communication is something that can always be improved upon, but I think we've taken some very strong efforts, and I think in some ways exceptional, with how we've worked to communicate as we've moved through the pandemic. And I provided some examples of all of the press briefings, the daily updates that we've provided throughout this, and that we have the was a daily briefing that we provided for elected officials across the region, that's moved to a weekly briefing to provide updates to them. And I do have time scheduled on a weekly basis with board members to be able to brief them on activities. And I'm certainly available by phone when they need to reach me. And so in summary, I feel that the District Board of Health and the Health District has been quite responsive to the concerns that were raised during that interlocal agreement, during the concurrent session. And I don't recommend further action be taken by the jurisdictions regarding the interlocal agreement at this time. So
Okay, thank you yes, please.
if you'd like to discuss that now, that'd be good, but I've got one more thing I did want to address.
Yeah, you're just about done with the report. I'd say finish your report and then we'll go
Okay.
back. Yeah.
So the other one is important. It's the budget meeting that I had with the city and county managers that's required under the interlocal agreement, and for me to report back on comments that we received from those managers during the meeting. It was attended by Manager Brown, Manager Kreutz, and Chief of Staff Dylan Shaver participating on behalf of Manager Thornley. And there was not really any substantive questions or comments. There were clarifying questions. Manager Brown asked about our FTE count and the increase in our FTEs, even though we didn't have an additional budget request for increased FTEs. And I explained that our FTEs had increased from 165 FTEs in FY21 to 168.74 in FY22, but that's because of some of those staff that Mr. English referenced that we brought on in the COVID response during FY21. Manager Brown said he had expected more above-base requests for staffing, and we explained that we had several vacant positions that we didn't fill during this past year that were health educators and our director of programs and projects, et cetera, that we were focused on the COVID response and not in some of those program areas during this year. So we do have those positions available to be filled. But we've been really working hard to try to avoid bringing on more permanent Washoe County staff in our COVID response. And so we've really been relying on temp staff hiring that we've done in conjunction with UNR's training center, a public health training center, and with some of the local temp agencies for staffing, as well as the Guard and the volunteers helping us out. And it just becomes quite complicated with the bargaining agreements that are in place for the other Washoe County employee associations, bringing people on short-term and bumping rights that they get and how that may impact people in other departments that have been employed through the county, et cetera. Then Manager Kreutz asked about the salaries and wages and why our COLA, why the budget didn't reflect a bigger increase for merit and for COLA. And Ms. Heenan explained that we've lost some of our higher paid employees to retirement over the past year, and so we've been able to replace those employees with more people at the entry level salary for those positions, which has helped to offset the costs of merit and COLA in this coming year. Then Mr. Shaver asked about the deficit spending that we were projecting for the coming year and why we weren't more concerned about that. And I explained both the healthy fund balance that we have, but also that we're staffing, our budget is for staffing at 100% throughout the year. We know that that's not going to be the case, and we'll have some salary savings there. And we also have some of our dedicated funds in air pollution control and solid waste management, the restricted funds, which show being fully spent throughout the year, but in reality, we usually carry those funds forward, a portion of those year to year. So that was a summary of the comments received. I just wanted to report out on that. So, thank you.
Thank you, Mr. District Health Officer. Questions for the District Health Officer from the board?
Hello, Chair. This is Christopher.
Councilman?
Yes, I do want to also comment on to our health officer, Kevin. Nick, I do believe you've been very responsive. Our whole group has been to some of the conversations, and I do appreciate the even work on communication even more. I do appreciate you bringing things to our forefront of how it works for appeals. I would encourage us to continue to go down that road and make sure that we just have best practices. And some of that, I do think it is wise to have. It doesn't necessarily mean that we couldn't keep the same people, but to have them apply and let other people have a chance to be in there as well. We have a lot of incredible community leaders, and I think letting other community in, which is what you've kind of done as well. I really wanted to say probably large kudos to us standing up our community groups and letting us hear from them of what the decisions we're making and how they're affecting them personally. I think that that's really crucial, especially in this next year as we come out of this pandemic. And it's gonna, we obviously have quite a road ahead of us of working together. My biggest heart for what I hope we do is that our health district at large and what we do is obviously we actually do get to hold up the boundaries of health and different things that need to be in place. But hopefully our constituents truly feel that we're here to work with them and guide them and teach them more than catch them doing something. And so I really appreciate the approach that's there. And I do look forward to seeing some of this unfold. I think, the biggest concern is making sure that as Kevin, as Mr. Dick steps out to make decisions, and I do believe he's been doing this, so I say that out loud, just decisions at large needs to make sure they represent us as a board, and I appreciate that being there. So thank you, and I just want to follow up that I do appreciate, and I personally do see all the efforts that's been made from those conversations. Thank you.
Thank you for those comments, Councilman. Any other comments from the board?
I have one, Tom Young,
Mr.
coming
Young.
here too. And I do think that one of the most positive things that came out of this process and the joint meeting was that we have put in front of everybody our appeals process and made it a something that is everybody can understand and knows that it's available and things too. And I guess it's already been used at least once since we've done that and things too. But we just need to continue to make that as effective for all parties concerned and things too. And I also would request that we do look into term limits for the Food Protection Advisory Board, and to try to rotate that out, mimicking some of what we just heard too. But I would like to make that a board priority so we can continue to get these boards and move forward. But good job on getting a lot of this stuff going, and I think we're moving forward and we're going to continue to.
Thank you for those comments, Mr. Young. Any other comments? Commissioner, please, Vice Chair.
Thank you, sir. Mr. Dick, I do want to thank you for bringing forth your report. I think you have addressed a number of the questions and issues that arise from that concurrent meeting between the three municipalities. However, I don't know if and I understand that your request is not to change the interlocal or any further action necessary, but I disagree. I think that we, as a county, are continuing to evolve. I think the interlocal agreement is old and challenged, and I think it needs to be addressed. And I think in June, when we have that look at that, we should do that. And I will go back to a comment I've always made is that, if you sit and rest on your laurels and think that everything you're doing is all right, then you're dying. And I don't think that's the case. And I don't think this health district has ever been that mentality or mindset. I think we've always tried to evolve and try to bring forth new innovative ideas, and just to rest on our laurels of what the interlocal agreement has been for 40 years and say, well, it just works. I don't necessarily agree with that. And so, yes, we probably temporarily addressed a lot of the concerns from a service level from the electeds, but I still think we have a duty to our community as it continues to evolve. And I say that as the chair of the county commission, we are a county that's always growing, and it's time to start to grow into that big county that we've always been from where we were. And it takes there are some growing pains that comes with that. And so I respect your position in regards to how you feel we've gone and what we've done. And I think you've done a wonderful job in the response. And this board has been very supportive of that. But I still think you can never say that we're always just good enough. We have to continue to strive to be better. And that would be my recommendation. I don't want to have a big long dissertation about this because we're not agendized properly for that, as this is just your report. But I would like to have this as a further discussion prior to the June reciting of the interlocal, and take that look at it. Not to make massive drastic changes, but I'd still like those conversations to be ongoing. Thank you, Mr. Chair.
Thank you for those comments, Vice Chair. Any further comments from the board? No, and thank you, Mr. District Health Officer. With respect to some of the other board members, I would like to, for us to consider some of the term limit opportunities for some of the other advisory boards. I think it's always good when you have an opportunity for those in the community to also apply. And so if that's something that we could work on, that'd be great. Also, a heads up when those positions become available, maybe, you know, as a memo or other ways, so we can reach out to other community members that an opportunity exists if there is an expiry or term limit coming ahead. And I know it's not on your report, but I'd like to hear how the conversations are going with the industry members in our community with relation to how we're going to reopen, or how those conversations are taking place. I know it's, so at our next meeting or even prior to a memo form, I know things are moving quick, but greatly appreciate that opportunity as well to hear how things are moving forward.
So Chair Delgado, I did include in my, my COVID update some of the meetings that were scheduled with the business advisory groups. And so if you'd like, I think it's within the.
Thank you.
So I've been, the Health District and myself, I've been working with Dave Solaro, the Assistant County Manager, who's leading the effort on to pull together the local reopening guidelines for after the state is providing for local control beginning May 1st of the year. And so that's a group that includes Mr. Solaro leading that, myself, Rebecca Venus, Assistant County Manager for City of Reno, and John Martini, Assistant City Manager for City of Sparks. Mr. Solaro brought on Erica Olson with On Strategy to help facilitate some discussions and the group moving forward. And we were able to have several different business advisory group meetings over the course of the past week and a half or so. So we had a group of business representatives that were event planners for our community and some of the larger events. We had a group with restaurant and bar owners. We had a group of retail entities that would also included a gym in that discussion, and museum as well. And we had a discussion with the resorts and around their operations and events that they hold as a separate group. So some good dialogue and discussion about their ideas about things that worked well for them as far as the types of measures that were taken as mitigations, and things that didn't work well, and things that they wanted us to understand as far as how some of the mitigation measures and requirements impacted their businesses in ways that perhaps we wouldn't otherwise have really understood. So from that, we had a lot of good input that we, On Strategy, helped to compile for us. And we're now meeting again later this afternoon to try to process all of that and understand it as we're working to develop what those local control guidelines we think should look like. And we'll be doing that over the next week or so. We did also schedule a wrap-up sort of loop-around meeting with the business advisory folks that will be occurring to help them understand sort of what we're thinking and going with. And the goal is to have something that we can present and make available to the public and to industry well before May 1st, so that there's better opportunity for people to plan if we do have changes in what requirements are going to be, so they're not stuck flat-footed like they have been occasionally with the way the state mitigation measures have rolled out. And so that will also require currently that a Board of County Commissioners meeting and approval, and taking the recommendations to the task force, state task force, which is currently scheduled for Washoe County to present on March 15th. So I think the consensus of the group, and I think also what we got from industry, I felt like was.
You said March 16th. It's April 16th.
Oh, I'm sorry. Thank you for the correction, Vice Chair Lucy. Yeah, April 15th. And but I think there was a fairly good understanding from the group, and I think the intention that we have in working to develop these guidelines, that we don't want to go too quickly and then have to move backwards. We want to be able to take measured approaches that we think are reasonable and assess how those work and continue to reopen, versus doing the open up and close down, which ends up hurting people even worse than not opening further sometimes. So we're trying to be successful in this approach to move to getting the economy back open while we're protecting the public health of our community. That's where we're at right now.
Thank you, Mr. District Health Officer. Any questions? I'd advise anybody from the board to please reach out to Mr. Kevin Dick. Also, with respect to some of these meetings, I've received some text messages from the early meetings, and it's been pretty great to know that people have been really open to being part of the conversations. They're really excited to be included as part of these conversations. And also, just for clarity, understanding how local control, what does that actually mean? I think there's some opportunity to still better communicate to the overall community that local control isn't necessarily quote unquote local control. We're still going to be held to the state. We present a plan, and they've got to formally adopt and support that. So I think everyone's really excited, and I think we hold our own destiny in our hands. As long as we're all able to participate and help, then we'll be able to achieve what we all want to. Any further questions? Seeing none, we'll close item 12E. Thank you very much, Mr. District Health Officer. Any general public comment for item 12 across the way?
No comment.
Item 13, board comments. Any comments from the board?
Mr. Manager, I'm sorry, Mr. Chair.
Yes, Vice Chair.
I do have a couple of requests. As the district health manager pointed out, we will have that presentation to the state task force for our final presentation on April 16th on behalf of Washoe County and the municipalities for our reopening plan for the May 1st date. That date will come and go in between our next board meeting, and quickly following our next board meeting will be that May 1st date. I would ask that Dr. Dow and Ms. Kerwin come back and present to the board a kind of an in-depth epidemiology report to the board in regards to the status of vaccinations, where we are with vaccine, potential herd immunity, how many individuals within the community have contracted COVID-19 and have recovered, and what we're looking at, and what some of those discussions are prior to that May 1st date, to provide some extra data and maybe some updated understanding to what the data is currently at that time of day, if possible.
Great, thank you. We'll take notice of that. Thank you, Vice Chair. I believe Dr. Novak, I believe you had your hand up.
Yeah, I sure do. I just want to let everybody know we've got a phenomenal operation in the parking lots out there in our vaccination center. And if we were the first mass vaccination center, it's been incredible. You look at where we've come, what's happened with it. I really am would encourage all the board members to at least go out and look at what's going on. I've spent a little time out there in the last 6 weeks, so it's been really interesting, but it is quite an incredible operation when a lot of these people go from the time they hit the first part of the driveway to out the other side in less than a half an hour, and it's just incredible because we're doing about 350 vaccinations an hour, and you think about just the amount of people in that's happening to. So please take the opportunity this next couple weeks before the next board meeting and at least go out and take a look at the operation when it's going. And I really can't thank our volunteers enough for being what they are. I mean, there are some cold, nasty days to be out there in the middle of all this, and I can't thank the volunteers enough for being out there. So great job.
Thank you for those comments, Dr. Novak, and thank you too. I know you're out there quite a bit volunteering yourself, and appreciate all the work you're doing. Nothing means more when you actually see the operations right in front of you. So thank you for doing that.
Thank you.
Chief Brown, did you have a comment? No? Mr. Young? No? Everybody else good? Any other board members' comments? I'll comment that, thank you, Mr. District Health Officer. I had the opportunity to shadow Diana at one of our inspections of one of our child care facilities. And it's pretty, we at times, and I'm very guilty of this, and thank you again to Dr. Novak, kind of taking the lead on these fronts, is getting out there as much as you can in a safe manner to kind of see the work that we do on an ongoing basis, the safety that we provide, and making sure that our littlest, most vulnerable kids are in a safe place, and that we do a great job in terms of making sure that even during this pandemic, we're going out there making sure that they are safe and they're well taken care of, from just going to a child care facility. And the professionalism that our staff has with some of those, the teachers and the owners, because it's at times gets very intimidating when we show up as inspecting their facilities, and just the comfort that we're able to walk them through to make sure that they know that they're doing a great job and what things they can do to that they need to take care of. So I appreciate the opportunity to shadow with them. Thank you so much. And I'll be shadowing others throughout the weeks. Just taking an hour, really, is all what it took. Commissioner, Vice Chair.
Chairman, thank you. I remembered one other thing I wanted to ask for. Could I get an update from the district health manager in regards to the SB4 inspections and how those are going? And kind of a quick update for the next meeting as well.
You'll get it.
Thank you, sir.
Okay, we'll close up item number 13 and move on to item 14, public comment.
No public comment registered.
No general public comment. Thank you very much. I'll look to the board for adjournment, please.
Move to adjourn, sir.
Motion. Second. All those in favor, aye.
Aye.
All opposed, motion carries. Thank you, everybody. Stay safe out there.